Now we're going to take a look at the conscious adult choking. Before we get started though, let's talk about a few things. First, is the scene safe? Do we have our gloves available or on? And then secondly, do we have some way to access EMS via 911 or sending somebody like, hey, you in the plaid shirt, go call 911 and come back. I might need your help, and bring an AED if you find one. So these are some establishing things that should always be part of our rescue, and those are all taken care of now. Secondly, when we are looking at the patient, there's a few signs and symptoms that we're looking for to establish if the patient is actually choking and needs assistance. Are they coughing? Are they talking? Are they breathing? If they're not coughing or coughing well, if they're not breathing, and if they're not able to speak, those are three major signs that they truly have an obstructed airway and may need our help. If the person is coughing forcefully, we're just simply going to encourage them to keep coughing and hope that they can clear that object themselves. In the airway obstruction, we have a sign called the universal sign for choking, which is the hands around the throat sign. In my career, not everybody does this. Many times they just look panicked. They might want to leave the room, but this is indeed the universal sign for choking. Once we see this, the patient is not coughing, not breathing, not talking, we're going to establish contact and see if we can help them. Sir, are you okay? Are you choking? He refers to himself as a choking victim and he agrees he wants my help. That gives me permission to actually help him. From this point, I'm going to then bring my hand up like a seat belt across his chest where my hand is virtually on his collarbone. I'm going to lean the patient over. Remember, we're going to establish the location between the shoulder blades with the heel of one hand for the back blows. And we're going to give 5 back blows. Firm enough to be able to push a little bit of trapped air up and out of the trachea and the larynx to remove the obstruction, but not so hard that we hurt them. And here we go, 5 back blows. 1, 2, 3, 4, 5. After I complete those 5 back blows, I'm going to slide that cross arm down in front. As I find his belly button, I'm actually going to make a fist and then perch the fist onto the finger. Once I've found the abdomen, I'm going to grab that fist and deliver 5 inward and upward abdominal thrusts. After I give 1, 2, 3, 4, 5 abdominal thrusts, I'm going to return to the arm across the chest, lean the victim over, palm between the shoulder blades, and repeat the process. 5 more back blows, followed by 5 more abdominal thrusts. We're going to continue this process until either the patient becomes unconscious, unresponsive, of which then we're going to help assist them to the floor and begin unconscious choking technique, or EMS arrives and takes over. I wanted to mention a very important special consideration as it relates to a pregnant woman who may be choking and conscious. It's important for us to understand that when a pregnant woman is in distress, there are 2 patients involved, the mother and the child. And it's important for us to save the mother's life so as to save the child's life. Now, that also includes not doing any further harm whenever possible. So like in a conscious choking victim, where we normally do abdominal thrusts, obviously if the baby is in womb and developed to a point where it's higher in the uterus, any type of abdominal thrust could cause potential risk to mother and baby by rupturing the placenta, hurting the baby internally. It's important for us to modify then our means of actually removing the obstructed airway without causing further damage, which we're going to demonstrate now. So in the pregnant female, we're still going to perform the cross body support, leaning the patient over and followed by the 5 back blows, like in the non-pregnant choking adult. But the difference here is that when we find ourselves behind the choking victim, we need to make sure that we're not pressing on the baby or the placenta. We want to go above that by going under the breast with the fist on the center of the sternum. The other hand is going to cup the actual fist that we're making, and we're going to do inward thrusts on the sternum. So those are then chest thrusts from standing from behind. 5 times, pushing air up the airway out of the trachea in hopes to remove the obstructed airway. If that doesn't work, we're going to go back to the back blows, 5 back blows with the support across the chest, followed again by the 5 chest thrusts with the fist on the center of the chest on the sternum. We're going to continue this 5 back blows, 5 chest thrusts on the pregnant female until they either go unresponsive, unconscious, or help arrives via EMS.